A meningitis outbreak in the Democratic Republic of Congo's northeastern province has killed 129 people since the first cases were discovered in June. For more on this outbreak, we're now joined via Zoom by Dr. Fouda, who's the Regional Meningitis Control Officer, the WHO Regional Officer for Africa. Thank you so much indeed for joining us, Dr. Fouda. Welcome to the program.
Thank you very much. It's a pleasure.
So how severe is this current outbreak of meningitis in the DRC?
You can say that this meningitis outbreak is severe because the lethality or case fatality rate is higher, around 50%. So that means that there is not so much case, but the lethality is very high.
And the nature of this virus, what's the potential that it could cross borders and we can see pandemic scenario playing out?
Not, for instance, it's a bacterial. So it's named Neisseria meningitidis serogroup W. So it's not a virus, but it's a pathogen named Neisseria. So, for instance, it cannot, but really, if we don't organize, for example, vaccination campaigns that can further cross the borders. But for instance, it's not the case. The risk is at the national level.
Why does this meningitis continue to break out periodically?
Yes, before 2010, we have meningitis A accounted for almost 90% of all meningitis epidemics. Then we introduced vaccine, so-called Menafrivac, and we have vaccinated more than 200 million people in meningitis belt. And then this meningitis A decreasing very significantly, and now we are near eliminations. Unfortunately, we have other pathogens as meningitis W, C, or X that continue to cause, to affect people and to cause burden in the countries. Also have others aspects of which is pneumonia. So really, people are not much protected against this serotype. But we have a new initiative that member states of African regions endorsed last month to really eliminate meningitis by 2030. So we certainly increase protection or immunity of people by organizing campaigns as we did for meningitis A. For instance, it's still a burden in meningitis belts, where we have 26 countries at risk.
So once you get a vaccination, one shot, is that it? Protection against meningitis for life?
We have 3 years for most of the vaccines that are available. But concerning, for example, Menafrivac, the vaccines against meningitis A, so it's 10 years. And we have some conjugate vaccines that can have a provide protection for 4 years. But average is 3 years, most of the vaccines that are available on currently.
Is the DRC adequately equipped to manage this outbreak and, as you say, keep it national rather than letting it spread more widely?
Yes, since 4 weeks, really treatment have been provided to people affected, because the situation we have seen was because people thought that it was a witchcraft and refused to go to the health facilities, but leave the area where they were working in many areas. So with the communications, with the community engagement, and also with all activities for sensitization, so people now accepted to really go to the health facilities to take their drugs. Also, the government sent mobile clinics to, because the area where the people are affected are remote area. So with the mobile clinic, they really consume all these antibiotics, so that since 3 weeks, the number of deaths is decreasing.
Dr. Fouda, we're going to leave it there. Thank you very, very much indeed for joining us and giving us some insights on how this outbreak will be managed. Thank you so much for joining us.
You are welcome. It's a pleasure. Thank you.